That's why you get more inflammation, more allergies, more food sensitivities. Do you understand? So this is our inflammatory diseases here. Now we can try steroids as doctors, or natural ways, or antihistamines to try to control this, but you won't fix it. The only way to fix it is to bring those cells back. Right? And who can do this? The good Lord. If we put the right things back in your body, He'll take care of it because He already put it in you. You understand? You got a Range Rover in the parking lot, brand spanking new. It's yours if you can put gas in it. Do you understand? Now, I know it sounds too simple, but it really works. So neuroimmune syndromes are defined by three major problems. Dopamine deficiency, which creates a lot of symptoms. T-cell and immune cell dysfunction. Neural inflammation, poor neural healing, and mitochondrial weakness. Okay? You following me? Keep going. Now, I want to talk to you about mood too, so you know that mood also is involved in this. Dopamine, this special neurotransmitter, is the balancer between our good time hormones, GABA and serotonin, and our anxiety hormones, epinephrine, norepinephrine, and acetylcholine. And in a perfect world, these are supposed to be perfectly balanced, right? Flip it. Well, dopamine controls these, and if you have low dopamine, these will not make themselves very well. And these will shoot up. Do you understand? And good luck getting out of that, because you can't just bring up one of these and feel better. You've actually got to bring up all three. And psychiatrists are starting to figure that out. With your SSRI, we're going to put you on a stimulant too. Do you understand? But if we can push your dopamine up, then what happens is it's a lot easier for us to bring these up naturally. And these will naturally go down. So does an SSRI cure depression? No. Or anxiety? No. Covers it up, may help you a little bit. You understand? But we got to get the balance right. Go. So let me tell you how these occur, because it's going to shock you a little bit, because it shocked me. Okay? Now, what I really want you to understand is, if anything, this slide. You were born with your genetics. That did not give you a neuroimmune syndrome. The genetics that we know of, every one of my kids have them. But none of my kids have a neuroimmune syndrome. You understand? But they have the genetics. So the genetics does not cause the problem. It consists of a vitamin D deficiency, a problem with that enzyme that makes methyl tetrahydrofolate, and sometimes an enzyme that doesn't break down dopamine very well. So if you're put into a mood that day, good luck getting out of it. You understand? It also has to do with what we're going to call a folate receptor autoantibody. Now that doesn't give you anything by itself. But if you get a triggering event, a vaccine, meningitis, saw 2 of those the last 2 days, environmental exposure, trauma, surgery, emotional, I've seen all of them. Do you understand? Doesn't matter what throws you down the vortex. What matters is, why can't you get back out? So once we identify these problems and we overcome them, we drop ropes down here, we pull you right out. Do you understand? Very, very simple conceptually. Very complicated biochemically. Now, what happened to this folic acid problem? Well, it turns out that we found out in autism and ADD and ADHD and dyslexia and developmental delays, 93% of children had a problem with the methyl tetrahydrofolate reductase enzyme. Okay? And you know about the MTHFR. Now the problem was that this usually creates what we call a high homocysteine, and we'll talk about that, if it's by itself. But it turned out in autism, it wasn't by itself. It was with other abnormalities. So if we can't make enough of this and we don't have enough gasoline, how well does this work? Okay? Well, it also turned out that we learned back in 2008 from Dr. Quadros in New York City, who was a cancer researcher. And we're not proud, we'll steal stuff from everywhere to get these people better. Okay? Well, he decided that he was going to try to send chemotherapy straight to the cancers. Good idea. Let's not poison the whole body. Let's just poison the cancer. So he decided he was going to make an antibody to folic acid receptors on cells, because cancer has a lot of them, right? But when he started looking at cancer patients, he turned out they already had an antibody. They had already made one on their own. Okay? And then he studied it more, and in 2009 he found out that that was directly linked to casein. And he found out if you had the antibody and you went on a milk-free diet, the antibody dropped. Now what that enzyme does is block folic acid from entering the cell. Do you understand? So if you can't get it in very well, and if you've also got the problem of converting it, you're really into trouble. Right? If we got a tanker full of oil, it's bad enough our refinery's not working. But if the tanker's empty and the refinery's not working too, we've really got a problem. Right? Now, Dr. Rosignol from Florida studied autism. They decided to do a study on this. They found out 46% of the children who have autism possess that antibody also. Now what it turns out in the majority of these people, especially young children, is that we see this antibody in kids who were not breastfed for the first 6 months of their life. Because it turns out in breast milk, there is a group of proteins called proline-rich polypeptides, and they seal the bowel. So that food, which is foreign materials in its full protein structure, doesn't get exposed to the immune system which surrounds the bowel. But if you don't give breast milk, guess what we substitute with? Cow's milk. So if you supplement your baby, or for whatever reason can't make enough milk, you get mastitis, child's in the ICU, there's all kinds of reasons. Then we substitute with cow's milk, and if this child has this immune aggression with their immune system, they develop an antibody to that casein which actually blocks the folic acid receptor. You've been so good. You really have been good. Does he need to go? Okay. He's just bored. Sounds like me in church when I was little. I need to go. Now, we've known about high homocysteine. There is a marker for that for all these problems that we can test in simple blood chemistry. High homocysteine has been known for 20 years. Glutathione deficiency we find in most of these patients, which is one of the chemical grabbing agents that helps us get rid of bad chemicals in our body. And homocysteine is found in what we call the methionine glutathione cycle. So we were really wondering when we started back in 2002 deciding to check homocysteine what we find in these patients. And it turns out if we have an MTHFR problem, this will be high, which means we're not making enough of this. But what we found in the majority of these kids with autism and adults with autism, instead of that being high, it was low, which most doctors think is perfectly normal. But I'll tell you, if there's not enough of this, how good are you going to make that? You following me? It's even worse to have not enough of that. You following me? Now why that's important, go ahead, is that we found out that there's two abnormalities to this marker homocysteine. Above 12, which is certainly recognized by most doctors in the country as a cardiovascular risk factor. Now unfortunately even the cardiologists have given up on that marker pretty much. But low is really a problem. Below 7 is abnormal, below 5 is pathetic. So when we studied kids with ADD, ADHD, and autism, guess what we found? And that's not a little study, folks. I'd challenge you to find 415 patients with autism in most practices. Okay? Now that number now, which hasn't changed the graph very much, and I didn't update it, is now up to 2,400. And it has not changed this graph one bit. You following me? Now when we looked in adults, it was a little different. We only had 76% of them below 7. But I'll tell you, most doctors will take that. You understand? So we should check our homocysteine. And just because it's low, that may not mean that you're not going to have a heart attack. It may mean it's actually even worse if it's below 7. Do you understand? Now, what you really came here for was this. I want to show you that there's research going on. We know what we're doing. We do this on purpose. And we give these studies at medical schools and everywhere else. So this is not just made up stuff. But what I can tell you, this is what you really came for. How the heck do we get out of it? Okay? Now, there are 4 primary rules to recovery no matter what you're dealing with. The first one is to control inflammation. If you hurt your knee and it swells up and you keep walking on it, it stays swollen, how well will it heal? It won't. So everybody knows that inflammation's got to go first. Okay? Then you got to have right energy, right? Mitochondria got to be working right. How many of those old people that just can't even get out of bed because they're so fatigued are healing? Anybody? Deliver necessary nutritional elements, and then you got to symptomatically support the patient so that they don't suffer too much when they're trying to get them well, because it doesn't happen overnight. Now, here's what I want you to know. If we have a methylfolate and methyl B12 deficiency, we can never heal the nervous system or the immune system, period. Because you can't heal nerves that are damaged and inflamed. And why? This shouldn't surprise us. How many women take folic acid when they're pregnant? Why? What happens if you don't? The brain does not develop. Shouldn't surprise us at all. In fact, in Honduras, there's a huge crisis. They have whole hospitals full of babies with spina bifida because some reason there's a folic acid crisis in Honduras. You know how expensive that vitamin is? About 2 cents a day. Do you understand? Now, we can't help it if some women can't convert it and they still get a baby with spina bifida. At least we tried. Mitochondrial energy, very important. If we don't have that, we cannot clear heavy metals and toxins, which sometimes get in our way. T cells don't function well, so we can't kill the thing that's causing the inflammation, right? Growth factors don't function well, and growth factors are things that deliver the nutrition that you're taking in. If you don't have a growth factor, you can't deliver fats, proteins, cholesterols, or minerals. And we cannot produce enough dopamine, which makes us feel awful. Okay? Now, this is the standard workup, and I put this in here mostly for the doctors, and we'll breeze by it. But basically what we want to do is outline a lot of things that most doctors skip. Okay? We want to know the homocysteine. We want to check the serum folic acid, because it turns out that the way we used to check for that antibody is we'd take a blood sample and send it to New York and wait 3 months for it to come back. Okay? But now it turns out that we've learned that if we just check serum folic acid, instead of it being 5 to 10 where it's supposed to be, when we check it, it's through the roof. Because it's floating around in the bloodstream and not going into the cell. And it's not because you're over supplementing, and we thought that at first, but we started checking people who were not on supplements, and guess what? There it is. Still through the roof. Do you understand? Want to check your vitamin D, your T cells, your thyroid panel, pregnenolone. Basically just want to make sure that you cover all the bases. Okay? We also, a lot of times, not initially check allergies. The problem is, if you check allergies at the beginning, there's going to be a lot of sad parents in here for kids and sad people for themselves because they're going to be allergic to everything they're putting in their body. Do you understand? So we've learned, let's fix the system a little bit first and then go check it. Okay? And then neurological testing for the sense review, it's available, and guess what, folks? It's available. Okay? Now, we developed a simple methodology, and I know a lot of you come here because you're involved in the hyperbaric oxygen program. Okay? What I've been trying to teach these doctors is very simple. There is no one modality that fixes everything. Do you understand? My methodology without a hyperbaric chamber works okay. But if I had a hyperbaric chamber in Austin, it would be better. Do you understand? Your hyperbaric chamber works good. But without the nutritional effect, how long does the hyperbaric effect last? You following me? So as a combined modality, you get an exponential effect.